Good afternoon, everyone. Good morning from Spain. So I'm very happy to be with you today. I have good memories of my visit to you at the time of the Asia Pacific Conference. So I remember very well that meeting that is in my heart since then. Today we are going to talk a little bit about Asia Pacific in the global view. So we are trying to give the world contents to the region to understand better the key issues of the development of palliative care in the region. I'm going to share my screen. Meanwhile, I have to say good morning to Megan Doherty from WHO Head Office that is with us today. So thank you for being with us, Megan. So, can you see my slides? Yeah, it's okay.
Yes, we can.
So first, Asia Pacific ranking of palliative care. Asia Pacific in the context of the world map with insights under the WHO framework. As you can see, this is a team effort. Is with us also Laura Monzon, that is the researcher for the region, and is with me for this presentation. We prepared together the presentation. But the ATLANTES team, that is a group of people addressing the situation in the world, is also part of this study. And you can see a detail of the cover of the Asia Pacific in the front page of this presentation. Okay, what we are going to see today. First, we want to revisit the WHO new framework of palliative care development, the house of palliative care. Then we will talk about the global survey that we already did in the last 3 years about the situation in 200 countries, the global survey of ATLANTES. And after that global survey, we published a paper just now in the last weeks, and we will introduce you at that paper that is talking about the classification of the countries in the terms of development. The last part is to reflect together about the different dimensions of the development in the region. And finally, I have a message for all of you. So we will start talking about the WHO framework. It's not so new because it came from 2021. So through the pandemic, people of all around the globe, including people from Asia Pacific, participate in a consensus driven by WHO with the technical assistance of the ATLANTES office. And we start with the umbrella. Probably many of you remember that the framework of WHO that was using through the years, it was one umbrella. And we convert the umbrella in a house. It's much better, actually, to have a house. So, because we understand the development of palliative care as the development of a house. We are trying to build together the house of palliative care in every country, building together the house of palliative care. And what means this issue of the house? So to develop palliative care, to have a house for those that are in need of palliative care, we need to put the different pieces together. That means that all at the time. We start with the foundation, as usually we do with the house. And in the foundation, there are two pieces that are the society, caring, empower people and communities. We have to develop this dimension in the society to care together. And also we need another foundation that is the health policies promoting palliative care. So with the society and with the policies. We can put the floor of the house that is research, because palliative care, as any field of the medicine, needs evidence, and the evidence came from research. After to have the floor that give us the comfort, we need 2 walls. The first goal is to have morphine and other medicines, so essentials medicines. But not only medicines are needed to care people, we need the right person. We need person with good training. So education and training is another wall, another dimension of the development. And finally, lastly, we have the service, the provision of palliative care through service that has to be integrated in the health system in the country. This is the new WHO framework for palliative care development. So we have to build a house to care people that is in need of palliative care. So 6 dimensions, and how we can understand or evaluate every of these dimensions. To start to estimate every of the dimension, that group, that world consensus group, develop indicators for every of these dimensions. A few indicators, because we try to estimate the dimension. We don't try to get the whole dimension at a time, but only several aspects that permit us to understand the size of the dimension. For instance, in Empower People and Communities, 2 indicators was chosen. One was groups promoting the existence of groups promoting palliative care, and the existence of advanced care planning policies. So in every of the dimension, few indicators, 2 or 3 indicators were defined. In education, for instance, 2 indicators was defined, that is the level of teaching in the schools of medicine and nursing of palliative care as subject, and also the recognition of a process on specialization for physicians. That's the 2 indicators that the group choose for that. So finally, we have 14 palliative care development indicators. Having this new concept of the development and the 6 dimensions and the 14 indicators, the ATLANTES team start to do a global survey, trying to find the answer of every of these indicators in the world. We can see there the office of ATLANTES with Álvaro, working with the maps, with the cartography, and Fernanda, that is working in Africa, and then Cristina, that is working in Latin America, and Eduardo in Europe. So every of the members of the team are working in a region of the world, trying to connect with the data and with the people that has this information. And with this as part of the work plan of ATLANTES as WHO Collaborating Center for the monitoring of palliative care globally. The method, how we obtain the information. We have a strict or scientific method to obtain the information. We divide the work in regions, and in every regions we did in the same way. The regions was America, the continents, and in some places as Americas, we divide the continent in South America, Caribbean countries, and North America, but then the continents. And in every continent, or in every region, I will say region, in every region, first, we build the net of informants. We looking for expert that accomplish 5 criteria. And with that criteria, we invite these people to receive training for the study. I will explain later. After to create the network, we obtain the data. I will explain on that. And then we analyze the data, and finally, we are in the process of disseminate results. So How we obtain the data after to create the network of informant? We invite to the informant to receive training in one formal course, e-course, electronic course, that the University of Navarra, my university, offer for free to this informant. And we, I would say, we convert the informant in consultant because we empower the informant in the method to evaluate the country. So we explain and we train the people in the method of the house and the indicators and the knowledge of every of the indicators with the definition and some bibliography that support that information. And through that process, the person, the informant, receive and is empowered with the training course and convert themselves in consultants, and we obtain national data. So the WHO Collaborating Center received through the course the national data of the countries through the platform that we are using for education. So in every country, we have not only one informant, but several, usually 2, 3, or 4 key informants that became consultants. So 4 consultants, 3 consultants sent us the data. And then the office, the ATLANTES office, produce a country report, trying to conciliate the information from different sources. And then ATLANTES offer this country report to the consultants through a peer review process, as usually scientific journals do. So without to know who is the other informants, they receive one consolidated or conciliated report. So we try to do to do agreement of the report between the consultants, and when the agreement is obtained, we say that the consultants validate the report. We have a report validated. After that, whenever is possible, we offer the information to the national association in the countries. Not all countries has national association, but where a 6 national association, we offer the information, and then the national association can endorse the information when possible. So we then produce with all the information these beautiful atlases of palliative care. You can see that we start with Asia Pacific in last March, if I remember well. And then in May, we present the Atlas of Palliative Care in Europe. And last week, I will say, or 10 days ago, we present the Atlas of Palliative Care in Africa in the Botswana conference. And now we are in the process of to present at the end of this month the Atlas of Palliative Care in the extern Mediterranean region, and at the end of the month too, the Atlas of Palliative Care of the Americas. So 5 atlases of palliative care that covers more than 200 countries in the world. What is an atlas of palliative care? That is also, you can see, you can take the atlas because it's freely available. But what is an atlas of palliative care? An atlas is a graphic view to present the development of palliative care in the 6 dimensions in every region of the world and in every country of the world. The atlas has 2 main sections. The first one is about maps. It's the cartographic section, that is the comparative section of the atlas. We present the atlas, we present the information with all the countries, and with infographic or with icons, we present every of the indicators in maps in a comparative way to see all the region at a glance. And then the other important part of the atlas is the country reports. The second section, or the second important section of the atlas, is country reports of every country. 8 pages of report, starting with 2 pages of one infographic that is a kind of summary of abstracts of the information that we are going to present in the following pages. So 8 pages with the detail of every indicators and the explanation of why that country in that indicator achieve that concrete level. We are seeing there the Atlas of Malaysia. So all the atlases are the same. Comparative cartographic section and country report section with the details. For sure, we present in the Atlas also the source of information and the endorsement of the National Association and the day where the data was obtained. So this is the atlases of palliative care that present the details of the development in the countries. But today we are going to present about the global ranking of palliative care. That is a paper that is still in press. You can see here that we will print it in the 5th of November. So we are 1 month ahead of this paper. This is the first ever global ranking of palliative care. Why the first ever? Because we never evaluate the countries at a time and with the same method and with this scientific way. So, yeah, and doing that at the same time and with the same method, we obtain a ranking. We can order the countries by the indicators that we develop through international consensus. And what we will obtain? A new world map. The world maps were done in 3 previous editions. I was presenting in the same journal, but the method was different. The first methods, the first global maps were more qualitative. The last world map was with 10 indicators and with no so detailed report of how to obtain the information. I was part of this study, I know well, but the method is slightly different that we are using today. So we have a first ever global ranking of palliative care and also the 3rd edition of the world map of palliative care development in the world. And this is the work, the collaborative work of the ATLANTES team with all the regional association and with all national association and with almost 1,000 of consultants that participate in the survey through this training course that we offer from Navarra University. So now we are going to talk a little bit about the global picture of the ranking of palliative care. As usual, you can obtain for free the paper today in the with this link you can find, but also you can find for free because it's freely available in the webpage of the journal. This is the map. So people is looking at their own country. Don't be worried. Now get the global picture. And what we can see in the global picture, we can see inequities. This is the more important. So there are a lot of inequities. Looks like that Europe is more dark, so meaning that has more development. We classify the countries in 4 levels: emerging, progressing, established, and advanced. Looks like that Europe is more advanced. It could be that palliative care is for rich country. That's not true. That's not true, but looks like that. So the first that call our attention is inequities. In Africa, palliative care is underdeveloped, and also in many countries of the Central Europe and North Asia, palliative care is seriously underdeveloped. In fact, we calculate that half of the world has not almost any palliative care services developed in palliative care. So only half of the countries has in some way more advanced or less advanced system for palliative care provision in the region. So the global picture are giving us these examples of inequities, but also can give us examples of leadership, because in every region of the world, we can find some countries, Uganda in the middle of Africa, or Uruguay in Latin America, countries that are leading the development of palliative care in the region, or Thailandia in your region with Australia. So inequities and also examples of leadership in palliative care development. So that's the global picture. In summary, 30 countries are classified in levels 3 or 4. Europe, and part of your region, the Western Pacific, has the highest concentration of countries in these upper levels, and more countries of the world remains in the levels 1 or 2. And this is happening in Africa, Eastern Mediterranean, Southeast Asia, that are all of them, almost all of them, in levels 1 or 2. So, because you want to see your region, here is your region. You can see the map of the, we can say the world map of Asia Pacific. So, and you can see that in that region, half of the region, that is 46% of the population plus 8% of the population, has established or advanced palliative care development in our classification. And the other half is strongly underdeveloped with levels 1 and 2, that means emerging or progressing. So 41 countries, that is the two WHO Asia Pacific regions, CRO and WIPRO, 41 countries and territories or areas with 2 billion people. That means a quarter of the population of the world has this level of development. And what are the leading countries? In dark, you can see Japan and Korea, South Korea, and also Thailand and New Zealand and Australia with the more advanced levels of development. If we see all the countries in a list, you can identify your own country and your neighbor countries too. So, and the countries are ordered because this is a ranking. In the ranking, you can find at the top regions or territories as Taiwan, and then Australia, Hong Kong, Japan, Thailand, New Zealand, Singapore, South Korea. And there are other countries that are following them, as Malaysia, Mongolia, China, Vietnam, and Indonesia. And many of the Pacific islands are in the level of emerging, and this is calling our attention and thinking in what we can do in the future in all those regions. I have to say that we use when possible, we use the denomination of countries, territories, or areas that WHO is following, and we don't have any intention to do political with this atlas, because we are doctor, nurses, professionals trying to develop palliative care, and not people that are doing any other business. So Asia Pacific in comparison with Europe, we can understand here that we can understand is that Asia Pacific has top leading countries, and not 1 or 2, but several leading countries. So the level of Australia, Japan, Hong Kong, Thailand are in the same level of the leading countries of Europe. So between 3.5 and 4, there are the countries that are at the top. Also, we can see that the second group of countries are less in proportion than the second group of Europe. This is a group that is thinner than the group of Europe. And is also significant that the lowest group, the level 1 group is more numerous in Asia Pacific than in Europe. So leading countries as the same level than in Europe, in Asia Pacific, but we have a serious gap in the Pacific with many countries underdeveloped. If we go to the details and we compare the indicators, the 14 indicators, the value or the average of the 14 indicators in Asia Pacific with the rest of the world, if we compare the global development with the Asia Pacific development, what we can find? We can find in green that there are slightly difference in several of the indicators and more strong gaps in other ones. For instance, indicator number 1, people. So in that dimension, the system of groups promoting palliative care is less developed than in the world. And medicine, we will talk later on about medicine. The reported annual opioid consumption in the region is lower than in the rest of the world. Very important, the number of schools that are teaching palliative care as mandatory courses in undergraduate level is also a red point in the development of the region. And this is seen in comparison with the rest of the globe because we have information of all the countries. Now we are going to see dimension to dimension, trying dimension by dimension, trying to reflect a little bit in those dimensions. Everyone can think in their own country, how the dimension is in the own country, but I'm going to give voice to some countries because I will show some example of good practice in the countries. Globally, in the dimension of in the foundation that is empower people and communities, I will say the society caring, the region shows strong programs in advanced care planning, more than globally. So the region, with this perhaps Anglo-Saxon tradition, influence the own culture of the countries. Advanced care planning is more developed than in other regions. For instance, we can see Malaysia that is robust, strong palliative care system in the last 30 years working in that. Now recently launched a national advanced care planning program nationally for the country. Also in that dimension, that is empower people and communities, remember that there was those 2 indicators. The first one is the system of groups promoting, doing advocacy. In India, not only Palliative Care Professional Association exists, but multiple organizations leading efforts in advocacy, multiple organizations. And in Singapore, as another example, the Hospice Council offer not only advocacy or information, but they start to offer services like a palliative care helpline. The next dimension is to develop right policies for palliative care. And here we are seeing countries that are leading the integration of palliative care at the primary care level. That is the future of palliative care for sure. But saying that we have good example of this, probably one of the indicators detect that some governments are not developed enough the governance of the palliative care system and has not a strategy or has not a office dedicated to the organization of palliative care, the governance of palliative care. But another examples are China, that mandates hospice care at all health system levels, and now is doing a pilot phase of community-based services. And Sri Lanka has a national strategic framework that are guiding the development of palliative care and are being used for the monitoring of the progress. Regarding research, it's interesting to see that the region has at least 3 journals of palliative care in India, Japan, and South Korea, dedicated specifically to palliative care, with a lot of scientific papers being launched in there. In Philippines, we have an organization not only promoting palliative care, but promoting scientific activities, supporting conference as the Root Foundation and Hospice Philippines. And in Australia, very recently happened the Oceanic Palliative Care Conference, repeating every 2 years, if I remember well, is giving us a strong research presence in the region. So congratulations for that. I put in black that slide because I would like to insist a little bit in this challenge that is the morphine. So sometimes when I present to my students, I try to encourage them, telling them that without morphine, no palliative care is possible. This is didactic, so that's not true for sure. That's not true. But I told the students, I would like to tell you today is without morphine, palliative care is not possible. And we need to pay attention what is happening with the use of morphine, because in this region, as you can see in this infographic, in this region, the access to morphine is not so important than in other regions of the world. We have good examples. Japan and New Zealand are good example of good access to the palliative care medicine, but we need more effort and probably we need more strategy because if without morphine you are developing palliative care at the level that you are doing, what will happen if you will have the right morphine? I would like to remember you that in some countries, as I mentioned Uganda previously, in some countries, the development of palliative care start with the increasing of the availability of morphine. When Uganda create a fabric of morphine to distribute morphine all around the country in the Hospice Africa, Uganda, since then, the development in the region increase. So I not recommend to put factories of morphine. In some places, that's worse. But we need to reflect on the issue to offer the possibility to receive morphine to those that are in pain at the end of life. And also in black, education. Remember, when we compare the region with the world, that we are seeing is that the region is in lower levels than the rest of the globe. So look at that. So only 5 or 10 countries are teaching palliative care to all future doctors and nurses. Of 44 countries, only 9 or 10 are being collaborating in this mandatory teaching for all future doctors and nurses. So in Black education, remember, we have to pay attention. And probably one point could be from our side. So it's not only the responsibility of the academia to teach palliative care, it's our own responsibility. As professionals, we have to arrive to the universities and to offer that teaching and to offer ourselves to offer teaching for the future doctors and nurses. Last dimension is specialized services integrated in the health system. The leading countries are well known, Australia, Hong Kong, Japan, New Zealand, Singapore, Thailand, but you can see that the provision of palliative care through specialized services is mostly underdeveloped in the region. So high-income countries as Australia perform close to the global average in general provision, and pediatric palliative care services remains limited across all income levels in the region. And now is your turn. So what is the future? The future is in your hands. You have to decide how to monitor progress. So probably after my presentation, you fully understand that to show the development of palliative care is a motor, a kind of motor of their own development. So serves to the people, serves to the professionals, is useful for the policy makers, that monitoring exercise, because give us the direction of the future development and give us the understanding of which points are weaker in a region to increase things. So adapt indicators, create your own working groups, present your findings in different forums. Probably here there is a role for the Asia Pacific network. So trying to train people in that in the future. ATLANTES is in close connection with the regional association offering support, but we strongly believe that the future of the monitoring has to be in your own hands. So why not to create a group of people that is monitoring the development every 2 years, for instance? Why not? So it's the time to act. So we have to build together the House of Palliative Care, and to monitoring the development is a way to build the house for sure. Let's work together to ensure that no one is left without relief, as our topic this year is telling us. Nothing else. Thank you very much. Thank you for your attention.